CSF. In chemical examination of CSF, we perform different tests to estimate protein, glucose, globulin, and some enzyme, LHD, SGOT, and CPK. So firstly, we will discuss the estimation of protein. Estimation of protein can be done by different turbidimetric methods. Protein molecules which are normally soluble in solution can be made to precipitate by the addition of 3% trichloroacidic acid. Protein precipitation causes the solution to become turbid. Thus, the concentration of protein can be determined by measuring the degree of turbidity. The absorbance of turbidity is measured at 490 nanometer. Precipitation can be achieved by sulfosalicylic acid and with sulfosalicylic acid in combination with sodium sulfate or TCA. Talking about the reagent used, 3% of TCA, 0.5% weight by volume stock protein standard. So we will prepare a working protein standard stock 0.1 ml. Normal saline will be 10 molar. Talking about the procedure, we will take CSF sample around 0.5 ml and a test sample in a test tube 0.5 ml and distilled water in blank 0.5 ml. Then 3% of TCA is added to 3 of the test tube, that is test, standard and blank. Mix them and keep at room temperature for 10 to 15 minutes and then read at 490 nanometers. Talking about the calculation, CSF protein can be estimated by absorbance of test divided by the absorbance of standard into the concentration of the standard. The normal value lie in between 15 to 60 mg per dl. Next we have sulfosalicylic acid test. Talking about the procedure, first take a 3 ml of 3% of sulfosalicylic acid in a tube. Add 1 ml of supernatant clear CSF in it. The cloudiness of the test is compared with that of the standard tube. We have number of different tests for protein estimation like Burette method, dye binding method and Dennis annealing method. Let's now talk about causes of increased protein in CSF. Well, when there is an increase in protein CSF, this is related to some abnormalities, but in case there is a decrease in CSF, that actually don't have any clinical significance and all. So let us discuss the causes of increased protein in CSF. It can be because of viral meningitis. Viral meningitis is simply the inflammation of the lining of the brain and the spinal cord. Then neurosyphilis is a kind of infection of central nervous system. Then subdural hematoma. Subdural hematoma is a type of bleeding in which a collection of blood usually associated with traumatic brain injury, like there will be a collection of blood between the inner lining of dura and arachnoidal matter. Then we have cerebral thrombosis. Cerebral thrombosis is a like a blood clot of cerebral vein in the brain. Okay, now this vein is actually responsible for draining blood from the brain. Okay, so next we have brain tumor. Now the brain tumor is a mass or a growth of abnormal cells. And next we have multiple sclerosis. Multiple sclerosis is a disease in which the immune system eat away the protective covering of nerves. Okay, So then we have acute bacterial meningitis. Again, inflammation of the layer of the tissue that covers the brain and the spinal. In case of bacterial, it is caused by bacterial. That is why it's called as bacterial meningitis. Then we have tuberculosis meningitis. Then we have spinal tumor. Then the tumor. Then we have cerebral hemorrhage. Cerebral hemorrhage is the condition in which a ruptured blood vessel causes bleeding inside the brain. Okay. Then intracranial tumor, that again brain tumor. Then we have Guillain-Barré syndrome. Now, Guillain-Barré syndrome is a rare disorder in which the body immune system attack nerves. Okay, this is a very rare syndrome actually. Next, we have estimation of globulin. For estimation of the globulin, Pandy test is performed. So, talking about the procedure, take 2 ml reagent in the test tubes, add 2 to 3 drops of CSF, examine the solution after each drop. Okay, then you will see some cloudiness, like some mm, milky solution. A fluorescence is a fluorescence will appear in the reagent that vary in intensity. Only a slight opalescence is significant and indicates the increased globulin. A coat of white precipitate, actually it will be some white precipitate and all, okay. So a coat of white precipitate form around a drop of CSF when it travels through the reagent. Like the solution will become some turbid. Now some of the causes of positive Pandy test are enlisted here. Like first is uremia, when there is a high level of urea in blood. Maxidema is like the advanced hypothyroidism stage. Then again the uh, cerebral hemorrhages, connective tissue diseases, syphilis, Guillain-Barré syndrome, Cushing disease. Cushing disease is related to the increase in the cortisol level. Then brain tumors, diabetes mellitus, then brain spinal cord tumors, then multiple sclerosis. So that's all we have for today. Thank you.